My name is Dan Joshua Oduor, founder and director, Stawisha Africa Initiative. Stawisha is an NGO that works in Siaya County, working with young people and their families. We are here today to celebrate and launch a project that is going to impact in our community. This project is called Jihusishe Nasi Project. It is based on sexual reproductive health as a concept, and we are looking to strengthen young people, especially girls, between the ages of 11 and 29. And these girls are going to be able to become ambassadors in the future within the area that we'll be working. We will work at Southeast Alego ward, and within this ward what we'll be doing is working closely with the practitioners such as the health sector, working with the religious institutions, and working with the national government. The question of the moment is why sexual reproductive health in this area? It's because nationally, and in Siaya as a county, the rate of teenage pregnancy has gone high. We are at 21% at Siaya County. That is way higher than the national average of teen pregnancy. So that calls for concern, and that is why today we've gathered stakeholders in the area where the project will be rolled, and they have pledged to work together with Stawisha to ensure that the girl of this generation is saved from possible teenage pregnancy and on matters abuse or related to sexual reproductive health. The components of this program are going to be, we are going to have what we call half-year clubs that would be rolled in schools. This would be targeting girls and boys in school, because the question was what is the space of the boy? And that component will cover both boys and girls. The second component is what we call youth cafes. Youth cafes would be community-based kind of forums where young people within the community, in this case the girls, are able to sit and learn from one another, what we call peer-to-peer learning, asking and getting the answers. And while that happens, we will have practitioners in the health sector involved in those kind of discussions to be able to guide and to be able to answer the various questions that they will have. Another component would be training on character and attitude change for our CHPs, that is the community health promoters. CHPs have been doing good work all along, and what we are saying is it's time that they be able to boost their morale and be able to change character and become more accommodative to the young people, so that the project is one that is taken seriously and the young people are able to feel the impact of this project.
My name is Aska Ngowo. I'm a community health assistant linked to Nia Health Center. I am currently working with 12 community health promoters. As a stakeholder in this project, it is expected that I act as a linkage between the community and the facility. As the director Stawisha had said earlier, Siaya County is one of the counties that is recording high teenage pregnancy. So in this project of Jihusishe Nasi, when it rolls out, we are expected that these teenage pregnancies are going to reduce, because these teenage girls will be having knowledge. And two, there is also a plan with Stawisha that them that are willing to go back to school, they get back to school. And this is expected to help to impact in our society, in that levels of poverty will be reduced. Two, the teenage pregnancy will also reduce in our society. And because we work with community health promoters, I, as a chair, I am the supervisor of the CHP, so it is expected that now that I am a stakeholder, the information that I have is also expected that I roll it down to my CHPs, so that as they visit these households, the CHPs have a message to deliver to the households. Thank you.
I'm Reverend Frederick Oluoch Omondi of ACK Baragulu under Maseno West Diocese. I'm privileged to be part of this team upon invitation by the director, who also happens to be our Christian. Stawisha, since its birth, we've seen a lot of things that it has impacted to the community. Among them, when we had our sessions, we realized since 2021, a number of households have been met directly or indirectly. Maybe to mention a few, 56 pupils graduated in 2021 after attaining some lessons on literacy. Then during COVID-19, around 300 families were reached with some food staffs and assisted in one way or the other. They are also working closely now that they are dealing with children, and as they said before, that when you deal with a child, it's definitely you will have to reach out to the parents. So some of the households have been taken through kitchen garden staffs. They have also reached out to schools, like most recently a school within our reach, Nyasidi. They donated 10,000 liters tank, which will help them maybe handle the tree planting programs, etc. So as a church, we want to believe it is impacting to the community positively, and we want to be stakeholders and work together with them, because we have sessions with our Christians like every week. So for information to reach the community, they have to make use of church leaders like us.
Kwa majina ni Monica Umukumu. Mimi ni msimamizi ya wamama, vikundi ya wamama kutoka Barding sub location. Tumekuja mafunzo na watu wa Stawisha. Mafunzo yao ni mzuri, itatusaidia huko mashinani. Wamama wameelemika upande ya kupanda hizi garden farms na hizi vyakula vya zamani, hizi za mahindi nini hizo. Tumefundishwa na tunaona tukizidi nao, wakizidi kutufundisha, watatuinua mahali na wamama wataerevuka. Alafu pia kuna masomo wanasaidia watoto wasichana wenye wametoka nje ya shule, wenye wamezaa kama bado, wengine pia wamelemewa school fees. Hiyo pia tumefunzwa, watasaidiwa, na tunajua tukiwa nao, tumeungana nao na wenye wameanza kazi yao, watainua jamii zaidi na watoto wasichana watakuwa empowered. Pia wa vijana wataona kweli hawajawachwa nyuma, kumbe kuna wenye wanaweza wasaidia, washughulikie ili wajue hali ya maisha venye inaweza enda nao. Juu napata vitu mingi wanaangukia bila kujua, lakini tunafurahia juu wamekuja na mafunzo na tunajua watatuinua zaidi, na watoto wetu pia wataona kumbe wanaheshimiwa, pia wako na haki ya kukaa Kenya ili wajue hali yao venye nafaa waendelee.